And as a reminder, we also have our infectious disease specialists, Dr. Prabhu and Dr. Thompson, with us as well. Questions can be asked via the raise your hand function and then waiting to be called on. Otherwise, you can submit them in the Q&A feature, and you'll see that button at the bottom of your screens. And we'll do our best to answer as many questions as possible. If you do ask a question, we ask that you include your name, the media outlet you're with, and to whom your question is directed. And just a simple plea to be patient as we try this digital format for the first time. My colleague, Kim Kaiser, is going to help us kind of navigate this and get us through this first one. So there's likely to be the occasional hiccup or delay, and we just ask for you to be patient and let us work through this first one. So without further ado, I think we'll start off with Dr. Pryor, and then we'll turn it over to Dr. Van Dielen. Thank you, Dr. Pryor.
Great, thank you. Welcome back, everyone. Though the setting is much different this time, obviously virtual time today. I'm Dr. John Pryor, President of Essentia Health's East Market. And as stated, I'm really pleased to be joined by Dr. Prabhu, who's an infectious disease specialist at Essentia Health and the real expert here with COVID-19. And of course, joined by my great colleagues in St. Luke's. If you'll recall our journey over the past few weeks, you'll remember that in early March, we were talking about how to stay safe and avoid spreading COVID-19. Things like washing your hands a lot, don't touch your face, practice social distancing, stay home. I'm going to repeat that last one, stay home. These precautions are more important now than ever. It's virtually impossible to get this virus if everyone in your household stays in your household. As our journey progressed, we started to talk at these press conferences about what healthcare systems are doing to prepare for a surge of cases. That remains our focus today. At Essentia, we are continually working to expand our capacity to care for COVID-19 patients. This includes increasing our supply of hospital and ICU beds and ventilators. We're also retraining and reassigning medical staff to maximize our resources for when we need them the most. Another major component of our preparedness efforts is predictive modeling. This helps us better understand the potential timing and scope of a surge, so we are as prepared as possible when staff, beds, ventilators, personal protective equipment, and other supplies that we need to care for an influx of critically ill patients when that all occurs. Those are all necessary steps, but I also want to spend some time this morning talking about hope and small gestures that collectively show we're all in this together. Like receiving a donation of 300 plus N95 masks for our colleagues battling the pandemic on the front line, or the little girl dropping off boxes of cookies on behalf of her Girl Scout troop, and the state trooper giving one of our cardiologists his own N95 mask instead of a speeding ticket. At our mobile testing site in West Duluth, a local restaurateur delivers lunch for our staff every day, no questions asked. Earlier this week, a woman presented us with 100 homemade masks. Attached was a note that read, "Made with love for our healthcare workers. I will keep sewing until I know you have enough." By the way, as a side note, we continue to need and accept donations of homemade masks. COVID-19 is real, it's serious, and it's scary. But at the end of the day, these acts give me and should give you hope during these uncertain times. Because one of the surest ways that we're going to get through this is by sticking together. And these selfless deeds highlight the best of a community that's doing exactly that, rallying around each other. We're grateful for and humbled by this support. And we'll do our best to reciprocate by working tirelessly to confront this virus and by providing the kind of compassionate, quality care our patients have come to expect from us. Thank you.
I think Dr. Van Dielen, if you want to jump in.
All right, thanks, Dr. Pryor. My name is Nick Van Dielen. I'm the Chief Medical Officer at St. Luke's and also an emergency physician. I'm joined by my colleague, Dr. Andrew Thompson, one of our infectious disease specialists, and appreciate this time to speak with you again this morning. St. Luke's continues to prepare and change as we watch this pandemic evolve. These changes are being made keeping in mind the best interest of our patients, our staff, our neighbors, really our region. As Dr. Pryor alluded to, this is a very different time for all of us. It's challenging. We are actively planning for our surge as well. We have a detailed plan in regards to our facility, the critical equipment and medications that are needed, and we continue to identify staff, train staff, and get them prepared for the surge we expect to come. It's not an easy task that we're involved in, and yet that's why we're here. And we are excited to be able to show our region the type of care that we can provide at St. Luke's. I would also echo Dr. Pryor's thanks to the community. We are so fortunate to be part of a community that is so supportive. We continue to receive so many gifts in kind. The cloth masks we still need as well, and again, what an outpouring of support in regards to the cloth masks, the support in terms of food, and really thoughts and prayers, and we really appreciate that. Most importantly, and I'll just echo again what Dr. Pryor has done such a good job of saying, your assistance in staying home, in isolating yourself from others, in practicing great hygiene, hand hygiene, covering your cough. Again, all the work that you do will help us do our work as the need arises. So briefly, I wanted to adjust just a couple changes that St. Luke's has made this week. So we've opened the St. Luke's Respiratory Clinic in our Miller Creek location. This is a clinic that is meant to provide evaluation and care of patients of all ages who have a respiratory complaint. This is a clinic that we hope will allow patients who have worked through our nurse hotline or accessed an e-care appointment or have contacted their primary and still need evaluation. And so this would be the place we would like them to go. It is our attempt to try and protect the other clinics and offices in our system so that patients who are particularly vulnerable to being exposed to illness right now can avoid being at risk. The clinic is open 7 days a week from 8 a.m. to 5 p.m. Much of what will be done within your car. It will be not the main entrance, but it's at the Miller Creek setting. It is a parking area on the right side of the building as you're looking at it. It'll be open 7 days a week from 8 a.m. to 5 p.m. And we will change those hours as the volume dictates. So, and again, I want to be specific about who is a great patient for that setting. So individuals who aren't severely ill, if you're severely ill, you need to go to the emergency department. But if you have a cough, sore throat, questions about sinusitis, body aches, even fever, it would be a great location to start with if you fall into that category that needs to have an evaluation. Again, as per the CDC and MDH guidance, if you're young, healthy, and really don't need an evaluation and you can work through some of those other tools, the best thing to do is to stay home and self-isolate. We will also be announcing at the same time that some of the hours in regards to our urgent cares are changing. So pay attention if you access one of our urgent cares, that's being done because of diminished patient volume throughout the St. Luke's system. And our acute care sites are currently closed. I want to just address masking because if you come to our facility, again, we are significantly limiting your ability to visit. but if you access our facility and are somebody who can visit, you'll notice that many of us will be wearing masks. Our direction now is, again, following MDH and CDC recommendations, while still being prudent and deliberate in our trying to preserve PPE, that personal protective equipment. So all healthcare providers who will have direct patient contact will be wearing a mask. Other employees we encourage masking for. We know we don't have unlimited supply and the supply chains are challenged. So that's where we'll be using cloth masks and masks that we are producing in-house. Symptomatic patients will also be wearing a mask, and again, that's to protect our staff. Our goal in this is really to protect our staff, our employees, really our community, because we know this is a very infectious disease. Other things that we've done that you may hear about, just so you're aware, all the primary care clinics are now offering curbside blood draws. And again, this is an attempt to protect patients from exposure to ill patients. So if you need to have your blood drawn, check in with your primary care clinic. They should be able to arrange that. And then at the Northland Pharmacy and the Lakeview Pharmacy, we'll be offering free mailing of your prescriptions. So again, a great way to continue to stay at home. And then I want to just briefly address a letter that the Minnesota Nursing Association sent to all hospitals about personal protective equipment. We at St. Luke's are completely committed to protecting our staff and providing the safest possible work environment. We are closely following the PPE recommendations from the Minnesota Department of Health and the Centers for Disease Control. We are also providing frequent communication and education regarding the proper use of PPE to ensure that all of our employees know when and how to use it. The worldwide shortage of PPE is real, as manufacturers cannot keep pace with the demand given the extreme use of PPE during this time. St. Luke's has been successfully working for months to secure supplies and equipment from both traditional and non-traditional sources. In addition to the outpouring of community support with really incredible efforts on behalf of our local manufacturing partners, and the donations from multiple sources, we've been able to maintain a good supply of critical PPE, but we know that we need to be careful stewards going forward. We appreciate all the help from our community partners. Thanks.
Thank you, Dr. Van Deelen, and thank you to Dr. Pryor as well. I think now we can get into questions from reporters, and again, just as a reminder, we have Dr. Prabhu from Essentia and Dr. Thompson from St. Luke's, our infectious disease specialists. So we'll open it up to questions here, and bear with us as we try to get to as many of them as possible.
So it looks like we have a question, a raised hand from John Lundy. Would you like to go ahead, John?
Yeah, can you hear me?
We sure can.
Fantastic. This question probably for Dr. Thompson and Dr. Prabhu. Earlier, Dr. Pryor mentioned the modeling that you have, and you've talked about a surge that's coming. Is there any somewhat reliable information that you can share as to when we might expect the peak to come in the Northland?
Yeah, this is Dr. Thompson. I'm not sure how reliable I would say it is, but I think the best models that I've seen would predict in Minnesota a surge in late April, and the Northland here seems to lag the metro area by perhaps a week or so. So I would roughly say around late April, early May is when I would currently expect the greatest number of patients. That might vary by many weeks, but that's, I think, the best models that I've seen at this point.
So I've been actually following the modeling, and there's a lot of different models out there. I don't disagree with what Dr. Thompson said. I think we'll start to see the surge late April, early May. The most recent models suggest that the peak will probably be midsummer sometime. But I think we just need to, everyone needs to understand models, it changes all the time. It depends on the inputs that you have, like the doubling time of the virus, how well we're doing social isolation and things like that. So as we change our behaviors, the models change as well. And so they're just our best guess today, and they could change tomorrow.
It looks like we have a question now about our mobile testing site. We received word that the testing site was moved from 46th Avenue West to 59th Avenue West. Can you confirm this? And also, can you explain the reasoning behind that move?
Dr. Prabhu, do you have the?
Yeah, I'm not sure on that. I know there were issues over the weekend because of the weather or the wind that may have affected sort of the tents, and they were rebuilding it, but I'm not aware of the move. Not the best person to ask. All I know is that we still have a mobile test site.
Yeah, and what I heard, it was weather related as well.
And Louis, it looks like we have Bonnie from KBJR who would has a hand up. I'll go ahead and allow her to talk. Go ahead.
Hi, can you hear me?
Yes.
Okay, great. So this is for Dr. Pryor. Last Thursday, you told us that you were just in the thinking phase of layoffs, that you didn't have any concrete plans in place. And then 3 days later, which included a weekend, you laid off 500 people. So can you explain in more detail the timeline and how that came about?
Sure. So we've been thinking all along, and we continue to think and make difficult decisions as this crisis is unfolding. And we've made the difficult decision to place hundreds of individuals on administrative leave. It's been primarily that, not necessarily layoffs, so that we can maintain as many of our care providing staff as possible to assist us with critical patient care during the anticipated surge of critically ill COVID-19 patients. And these leaves are scheduled to last 30 days, after which we're going to reevaluate our staffing needs. In addition, we're also reducing other colleagues' hours to match patient volumes and reduced work in business areas. However, this is not unexpected. Flexing to volumes in patient care is nothing new. We do this every day. The difference is that because we have seen a reduction in elective surgeries and volumes in general, there's just more flexing than usual. So those employees can use vacation or paid time off to reach their regular pay, or take unpaid time off.
I have a follow-up. I'm not sure if you can still hear me.
Yep.
Okay, great. You know, between testing and then this layoff issue, there's been some inconsistencies in your messaging over the last few weeks. How do you think that is impacting the community's confidence that you can handle the crisis that's coming?
So, I'm sorry, what inconsistencies in testing? And what inconsistency? I don't understand the inconsistency part.
Well, 2 weeks ago, we were told on a Tuesday that the hospital had plenty of testing supplies. And then 2 days later, we were told, oh no, actually, we don't really have any testing supplies. And then as I mentioned, last Thursday, you said, oh no, we're not laying anybody off or putting anybody on leave. And then 3 days later, 500 people were told that they were either being laid off or put on leave. So it's just these kind of going back and forth that we've had some people commenting on our social media and sending us emails that it seems that there's inconsistencies in your messaging and in the way you're responding.
No, I think that from what I recall, there's a lot of consistency. I mean, we strive to be very transparent and truthful. When in the supply discussion, we said we have plenty of supplies today, but we may not tomorrow, and we have to watch our supplies. And our understanding of where supplies and when they're coming changes on a daily basis. So we've been very consistent from the very beginning that supplies is something that we're worried about going forward. We have plenty of supplies today. That's no different than I said a few weeks ago, but again, is something we're worried about that could change tomorrow, especially given the surge in patients. In addition, last week when we talked about layoffs and furloughs, as you pointed out, as you played back, I said, we're thinking about this. There are no plans right now that we're going to make the decision to lay off people or to have them go on administrative leave. But things change, and I've been very consistent about this. Things change on a day-by-day and an hour-by-hour basis. This is a rapidly changing environment. We get news every minute about different things going on at the federal, state, and local level, and we have to respond accordingly.
You said in your opening remarks, though, that we're going to get through this by sticking together, and that seems to be contradictory when you're then sending 500 people out of your workplace.
I don't think so. Actually, I think it's very consistent. The way for us to stick together is basically, and this is about Essentia and the entire community together, there are sacrifices being made by everyone. When people are staying at home, that's a sacrifice. The loss of contact with each other. When people aren't at work, that's a sacrifice. When we let people, when they go on furlough or administrative leave, that's a sacrifice. And we have to do that so we have the money to pay the people when the surge happens, and we need to have all hands on deck. So these are sacrifices that we're all making, and Essentia and our employees are making sacrifices as well. So I think that's very consistent with my message.
Can you explain, though, how you managed to identify 500 people in the space of a weekend? It just seems, it just seems incredible to me.
We're working 7 days a week. It's not like we all of a sudden started thinking about it after that press conference. As I said in that press conference, we are thinking about that. We thought about that. I mean, we've been thinking about this all along. We have thoughts. We're trying to think ahead. We play basically different scenarios. What if this, what if that? Because again, this is a rapidly changing situation. So what is true today could be different tomorrow based on the situation at hand.
Bonnie, I'm gonna jump in here right now. I think we can come back to this topic if needed, but
Okay.
right now I would like to open it up and see if there are other questions that we can address. I appreciate you bringing that topic up, but
I do have a couple other questions, just FYI.
Let's maybe see if we can come back to those at the end.
Okay.
So we have a question from Renee at WDI, who wonders about if each hospital can talk about the number of ICU beds they have in light of what is projected to be a shortage.
So I can jump in quickly. So when we are planning for surge, we think about it as a tiered response based on volume. And so what I can tell you is that our surge planning includes doubling and tripling and then exceeding that capacity from an intensive care unit standpoint. So from a facility standpoint, from a bed standpoint, down to the ventilator and the equipment needed, that's the granularity of the planning that we're doing and the labor pool to support it. What I would say is that St. Luke's, like many healthcare facilities, and I'm sure you've heard this, we have a fixed number of ventilators, and we know that those can be critically important for these patients. So I would say that we are planning and looking for options in regards to some equipment that we would need in order to meet that, tripling of capacity.
And I'm going to address this one maybe to Dr. Prabhu. Dr. Prabhu, if you could speak on, and maybe Dr. Thompson as well, how the testing process is going. Is it getting better? We've alluded to it a little bit, but maybe you could just address that a little bit more in depth.
Sure, it's Rajesh Prabhu. So I guess maybe people have known in collaboration with the health department, they've kind of expanded their testing criteria. In general, it's the same. So their priority lists are people that live in congregate settings or get care from congregate settings. So example, long-term care facilities, prisons, jails, homeless shelters, dialysis units, because there's a lot of people in our region that depend on dialysis for their kidney failure, hospitalized patients, healthcare workers, that take care of immunosuppressed patients or cancer patients, etc. The biggest change, I think, is that testing has been expanded to anyone over the age of 65, whether you have an underlying health condition or not. And the reason for that is the older you are, there's a higher risk of having a more severe version of the illness. The other thing is if you have any underlying health conditions that put you at high risk, that's open opportunity for testing. And first responders and childcare providers. Those are the main groups that have expanded, a group of 8, and we will be following those recommendations. We do use our reference lab. The health department is basically open for particular health systems that don't have access to a reference lab at this point. And the reason it's not, and I guess with one more comment about testing supplies, the reason it's been that particular list is we do talk to all the health systems in Minnesota in terms of what the status is of testing supplies. So it may not be, I guess, the PCR test that you actually detect the virus, but it's the swabs that we use, the transport media. So it's more like we don't want to burn everything up front because we may need those supplies when the surge hits as well.
Yeah, this is Andrew Thompson at St. Luke's. I would agree with what Dr. Prabhu said. I think some of the difficulty in understanding our limitations with tests has been that there are limits at various levels. One is, do we have enough swabs? We know our quantity of swabs is limited, and we want to make sure that the people who need testing get testing. So we have to, again, be good stewards of the swabs. Do we have enough test tubes with the right media in them to send to our reference lab at Mayo or the state health lab, and are they able to perform them? I know that the time required to perform the testing has gotten longer as the testing criteria loosens up a little bit. And at those reference labs, do they have all the reagents and chemicals they need to perform the test? So there are multiple steps along the way that have been limiting the availability and speed, but we are trying as best we can to get those tests to the people who need them the most.
John Lundy, did you have a question?
Sure. There was a reference in the phone conference earlier this week with Senator Klobuchar to a care center at College of St. Scholastica. I hope I'm quoting that accurately. I'm interested if any of you can expand on what that means.
So I can speak to that, John. As you've probably seen in other localities, the resources available to care for the number of patients who could become infected with COVID-19 in a hospital setting at a certain point can be exceeded. And so the discussion around the College of St. Scholastica had to do with vetting a community site for providing some level of care for patients who are, we think they don't necessarily meet the needs of an acute hospitalization. So they've been diagnosed with COVID-19, they're improving, but they can't go home, or they perhaps can't go back to the group home or the long-term care facility that they reside at because that could infect other individuals. So, and it may at some point be just based on numbers, we need to have a third facility. So that's a process that's driven through the statewide healthcare coalition in accord with the Army Corps of Engineers, and they have strict criteria that they use to vet spaces as to whether they can be repurposed to provide an alternate care site.
If I can follow up, if that were the case, how would that be staffed?
That's yet to be determined. The logistics piece would be supported federally, as I understand it. There would be opportunity for the healthcare systems and the hospitality industry to contribute and support it. It really depends on what that facility looks like, and that depends on what the community's need really is. So I would say to be determined.
Bonnie.
Oh, hi. Yeah, this is going back to Dr. Pryor. I know you mentioned when you're talking about staffing that you're concerned about not having the financial resources to pay those people, but Essentia has $1 billion sunk into the Vision Northland project. You're funding everything like the air show. Has there been any thought in conserving those resources to pay staff to keep them on the job?
So the funding for the Vision Northland, our new hospital, is coming from bonds and also from some support from the state as well. And so that's a completely separate category. We cannot use that money to pay staff. That's not allowed. And in addition, one of our values is stewardship, and that translates to being very careful with our resources. So to have people here today who basically, because of the decreased volume, we don't need, that is not good stewardship. We need every single resource we can to prepare for the surge. This is something that every health system is going through across America. And believe me, you're gonna want to have the staff and the resources and the facilities around and open when the surge happens, sometime in the next month or so.
On that note, the governor during his press conference yesterday, I believe the economic development director was encouraging people who have been furloughed or laid off, or however you want to say, from their healthcare jobs to get new ones. He said there's plenty of jobs in the healthcare industry, whether it's working at nursing homes or some of those kinds of facilities. So how concerned are you that when you need those people, they won't be there because they'll just have moved on to a new job?
To the best of my knowledge, right now there are probably close to 0 jobs open in healthcare. Everyone is thinking of either furloughing or laying people off to be also good stewards of their resources. So and our plan in this furlough is that when we need them to call them back up, our goal is obviously to keep people employed and to use them when we need them. And so we're hopeful for that.
Okay.
If I could just weigh in from St. Luke's. So as Dr. Pryor described, this is a challenge for every healthcare system. Certainly St. Luke's is challenged. Our volumes are down across the board. This is what we're hearing from all of our partners in healthcare. And we regret any employee who we don't have enough work for, and yet we have to be good stewards during this time, which may be several weeks, depending upon which model you look at. It is true that when the surge hits, we're going to need all of our employees and probably more. And we are actively looking in this time of low need, how can we repurpose staff that we just really don't have work for to find them things that they could do, but there is a limit to that. So this is challenging. We really appreciate the patience of our community as we try and walk through this, but no healthcare system is immune to this.
Dr. Van Deelen, you mentioned last week you had laid off 7 people, I believe, was the total that you gave us. Has that number changed at all in the last week?
I probably don't have the latest number. I do know that number has increased. Some of them have been voluntary, but I don't have a specific number for you.
I mean, increased by a lot or a little? Can you estimate?
My impression is that it's a small number.
Okay.
I want to get to a few other questions here. And there was a question about the kinds of jobs that were a part of layoffs, specifically at Essentia. And I do want to clarify that those among the 500 that we announced earlier in the week were non-medical jobs. So just to clarify that, John Lundy also wants to know if we could clarify the testing reference labs. Does that mean testing is taking place at your facilities? And what's the turnaround time for testing?
This is Rajesh Prabhu. I can answer that. So we're not currently doing testing in-house. We're looking to bring that capability online because we do have the testing platforms, but again, it's a limitation in the supplies from the manufacturer because they are prioritizing other parts of the country that need it, I guess, because they're experiencing the surge now. So we just use for our labs, we do a lot of lab testing in-house. Anything that we don't do, we usually send to our reference lab. Our reference lab here in the East Market is the Mayo Clinic.
This is Dr. Thompson at St. Luke's. We are in the same situation. We use the Mayo Clinic for our tests. The state public health lab is also available, but we've been using the Mayo Clinic now. We would like to have a rapid in-house test, and we are awaiting, again, the kits which we can run in-house, but we don't have it yet.
I think we'll do one or two more questions here and then wrap it up. Renee at WDIO wants to know if someone could speak to the situation that doctors have seen so far in treating COVID patients. Yes, they are numbers, but they're also people's loved ones. So maybe doctors Prabhu and or Thompson could speak to that.
I can start. Andrew Thompson at St. Luke's. Most of the cases that we have seen of confirmed COVID have been fairly mild symptoms. People who go home and isolate in their homes and have a cough and a fever, and they will recover without further treatment. We have had a few fairly ill patients in the hospital, much like we've seen reports from elsewhere who have respiratory failure. You know, it's consistent with the type of severe illness that has been seen around the country and around the world.
Yeah, this is Rajesh Prabhu. I think parallel Dr. Thompson's comments, the same. Most of the people that are getting positive test results in the community are able to stay out of the hospital, but certainly some that get admitted are in a similar situation, as Dr. Thompson had described.
I think we'll go one more, Bonnie.
Yeah, the state was talking about how it is trying to expand its capacity for ICU beds just statewide, and that they had been looking at locations here in Duluth. Can you guys comment on what those locations were? And then once one is identified, will the hospitals here locally be responsible for staffing it, similar to that one that's at St. Scholastica?
So there is a state level command center, and our hospital reports to a regional healthcare coalition that has set up a command center that then reports to the state level. All healthcare organizations throughout the state of Minnesota report their ICU capacity to the state command center. And as this pandemic progresses, and if we experience a surge similar to what we're seeing in other states, the state will at some point start to apportion patients to healthcare systems that have capacity. So yes, we at St. Luke's, and I'm sure at Essentia, we contribute to that system. We expect to be a resource for the Twin Cities, and we're actively preparing for that eventuality.
So I think with that, I know there are still a few unanswered questions, but we are getting into about 45 minutes now. So I do want to be respectful of the doctor's time. If you have unanswered questions, feel free to reach out to myself or to St. Luke's afterwards, and we'll do our best to answer them. Before we do sign off, I do want to ask if any of the doctors have any final remarks they would like to make.
Well, I'll just say again, I really appreciate working with St. Luke's, and it's part of my message that we all have to do this together. And I just think that we're better off working together than not. And I also appreciate working with the community and all the wonderful outpouring of support that the community has shown. And so this is going to take a lot of grit and determination, but I think that we can all do this, and we're going to make it through this. And ultimately, when we come out on the other side, we're all going to be better for it. And there's great things that we're doing right now and learning from this, including all the virtual visits. So let's just stick together in this. Thank you.
I would echo what Dr. Pryor said. I think, again, we have weekly meetings with Essentia. We're constantly in communication. The level of collaboration our community members need to understand has been truly remarkable. And it's because we're all experiencing the same things, and we're all focusing on how to best provide care for our community. So we do really, really appreciate the great work you are doing at home. And again, as Dr. Pryor said, stay home. But thank you for all the support. We really appreciate it. And we'll be here next week.
Absolutely. I think with that, we can wrap it up, and we'll plan to do the same thing again next week, virtually, 11:30 a.m. on Thursday. If that changes, of course, we'll let you all know, but we'll send out an advisory to remind you of that as well. So thanks for being with us this first time online. Thank you for your questions, and have a great afternoon, everyone.